I want to welcome you to tonight's special webinar that we will have Dr. Praveen Arany, and he has years of experience, over 25 years of experience with light. He is a dentist by his practice, and he ended up doing research at the University of Buffalo, and has been head of WALT, really special guy, and done a lot of research on why light therapy, what the mechanisms are for light therapy, and why light therapy or PBM, photobiomodulation, can make the difference. So what I'd like to do is just a couple of announcements right up front here. As we've said before, those that have joined in for the entire month get a chance to be drawn every time they join us and watch for the whole program. They get a ballot into the box, so to speak, and the draw is done. So I just want to try and see if we can make this work. I'd like to see if I can bring one individual who has purchased one of the light units back a ways, Wesley Hansen. If we're going to ask you if you can just join us for a sec. There he is. How you doing? Oh, you got to unmute your audio.
There we go.
Okay, well, thank you for joining us on an impromptu. Wesley had purchased one of these backways to help his wife, but with knee surgery. But I wanted to bring him on because Wesley, your name was drawn, so you have a super palm coming your way.
Thank you.
So I know that you'll put it to good use. You've encouraged others as well about the use of the light. And anything you'd like to say?
Well, as I shared with you on the phone, I do have a number of two palms, and I have the array, and we use it all the time. And I think it's a very beneficial to our healing in many ways, and have just enjoyed the use of the product. I've used it to help with, I've got a surgery scar here that I've been using to help to change the tissue, and it's working quite well. I don't think I need a revision surgery at this point for that. And my wife Darla had knee replacement surgery, and as I was sharing with you, we didn't get a chance to use the array as much as we wanted to because she was in a lot of discomfort for another complication that arose. So when we do the right knee, we'll make sure that we get a chance to have a good study and give you some good feedback on how everything went.
Excellent. And I'm sure that you have a family member or someone that could possibly use the palm that you're going to get.
Absolutely.
Okay. Well, good to having you join us. All right. Okay. So so it'll be there's a draw tonight for those, just as I mentioned. This is for the Super Palm 1050. It's a 1050 nanometer wavelength, and it has it's a beautiful device, and it's valued at over $1,900, well, if you'll be put in the draw this month for the month of December. All the best for you, for one of you to win that. Okay, so we'll get the program going. Do you want to let Tom talk? Yep.
PBM stands for Photobiomodulation. Photo being light, bio being biology, And light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy. And then there's a host of different processes that are stimulated because of that light. So you can speed up healing. You can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can.
Well, so tonight I had hoped that we would have Dr. Praveen Arany on live so that we could ask questions directly to him, or the audience could. And unfortunately, scheduling didn't work for him, so we did a recording earlier today, and we will be playing that recording, which is talking about burns and wounds, and I'm sure you're going to find it a lot of very good information from it. So now what I'd like to do is I'd like to start off with some slides showing the effects of PBM on burns and wounds, and then we'll get into our video recording. Okay, there we go. We'll go to the next slide, please. So just to show you, by the way, there's some ugly pictures coming up in the next few slides, or number of slides. This happens to be my granddaughter. She was 3.5 years old, and she was in the kitchen with my son-in-law, and usually she knows exactly how to mix the Jell-O. So he just finished pouring boiling water into the bowl, and for some reason she decided to pull the bowl closer to herself, and in the process the bowl flipped and poured boiling water down her leg, She had some pretty nasty burns there. They figure second-degree burns, maybe even touch here and there of some third. But anyways, you can see in day zero what it looks like. Day one, day two, and then by day four, you're seeing a overall covering nicely of the area. And by day six, you see it all scabbing up. And then by day eight, all the scabs fell off. And what I'm unfortunate, I don't have a picture, but about a month later, you could still see that there was a change of color in the area where the burns had taken place. And now you see the final one on the right-hand side, bottom right-hand corner. There was got a picture just now that was happened 2 years ago, and there's no visible signs of scars anywhere there. So it was absolutely beautiful healing. Next slide, please. This is a person who had boiling oil on their hand. And this is from a dentist in the US, in New York State, Dr. Larry Cutlow, and a patient that had burns, pretty bad oil burn on their hand. And you can see how by about a month's time, how much healing took place. And then the final picture, or at least the middle, which was what was that? Anyways, it was a couple months later, and then the final one. So nicely healed. And now it just you can't even see it years later. Next slide, please. A woman with real bad burns on her face. And this was another slide that was presented to me, and PBM was done daily. And you can see on the left-hand side, the right-hand side, improvement. Next slide, please. And here's a young boy that ended up nasty burn on his hand. And there was no grafting that was needed. And you can see at the 5-week mark that that there's beautiful looking skin there that all had formed. And that's one thing that's really nice about this. It helps to prevent scarring, and not only scarring, but helps to speed up the healing, so there's less chance of infection setting in. Can I have the next slide, please? I actually was able to see this firsthand back about 15 years ago. Well, it was 15 years ago that I started with the PBM, learning how light could be so dramatic in helping with wounds and burns and different things. And I ended up hearing about the earthquake, and I made some phone calls, and I knew my light technology could be very helpful for burns, because you can basically speed up the time and double, like in half the healing, half the time normally that it would need to heal. And so I went down to Haiti. I was invited and ended up with on a plane load of doctors. I am not a medical doctor. I'm a designer of all these electronic devices over the years, past 40 years. But in this case, I had the light technology, and I was invited. And the hospital itself, you can see by the picture in the upper right-hand corner, sections of buildings were just demolished, flattened. And what part of the hospital you see here, other parts were ready to come down any moment. So we were in that, basically like MASH tents outside the hospital, and we were treating people with the light. And the weirdest thing is that if you've ever, I'm sure you have had a sunburn somewhere along the way, and when you have a sunburn, you feel that the very last thing you want to be is under light, at least light from the sun, because it right away stings and burns. And if you have a bad sunburn, and in this case, because the wavelengths are in the red and near infrared band, you don't feel, you actually, it's a soothing feeling. So it actually reduces the pain almost immediately, and that's what we were able to see with my granddaughter. Next slide, please. Here's I'm bringing this picture in because of wounds. Anytime you're doing surgery, you're causing a wound. Well, in the first place, this fellow had used a pickaxe and swung the pickaxe and cut the tendon right off, as you can see in the left-hand picture. It was severed right in half. They did this. Actually was a second surgery, which was within a week. So the first one, they attached it and then it fell apart, and they had to do a second surgery and reattach it a second time. So much bigger surgery. You can see in 2 weeks how much the inflammation is way down. It's looking pretty good. And then in 3 weeks post surgery, you can see the picture on the right. Can I go to the next slide, please? So left-hand side, you can see 3 weeks. Now, this individual was told that it would be 6 to 9 months before he would be using his foot again, with walking and that. And you can see here 3 weeks post-injury, and here he was doing treatment every day, several times a day on that whole area. And then on the right-hand side here, you can see 4 weeks post-injury. Go ahead. He's walking on a foot that he wasn't supposed to walk on for 6 months. So you can see it's pretty amazing. Next slide, please. Yep. Here's a diabetic foot ulcer that had gone really bad, gangrenous, and they were going to amputate the foot, below the knee, and anyways, they were able to get one of the lights into the hospital, one of my palm lights, the super palm actually, and they started treating, and within 1 week they canceled the surgery to remove the foot. And within 2 months, you can see on the right-hand side, it almost had closed down. And there was about another 2 months where it was totally healed then. And diabetic ulcers of any kind are really bad to heal because the blood sugars and healing process. Next slide, please. Here's an example of a surgery on a chest for basically 4 weeks post. You can see how quickly this area had healed, and very nice, almost invisible surgery line. Next. This shows an example. This same individual, he also took a picture like this. Unfortunately, the lighting is not perfect in that the arm has got, because of the angle of the shot, but you can see that the arm has healed up really nice and smooth. And he treated his arm every day, but because he likes to always wear long pants, he decided only to treat once a week his leg. That's his thigh, inner thigh, and you can see how it's still not nicely healed like the other areas, like his chest or his arm. So it's very important for something like this to be treating on a daily basis. Next slide, please. Oh, this is myself. I decided to do a face plant into concrete. I just happened to turn. I was in the middle of a street and I landed face forward right on concrete. I didn't have any chance to put my arms out to break the fall. So I bounced off the concrete. I lost my tooth in the process, and everything was pretty swollen. That's a picture within very shortly within an hour of the, well, I think, yeah, about a half an hour within the after the event. And 4 days later, you can see how nicely the healing went, and I was able to look a whole lot better very quickly. So swelling went down, healing, very good. Anyways, next slide. Just showing you the difference between 660 nanometer and 810 nanometer. That on the right-hand side, you can actually see the 810 nanometer going through my gum line. Next slide, please. So now what we're going to do is we're going to shift over to the recording that I did earlier today. with Dr. Praveen Arany, and we'll start the recording. Well, I'd like to welcome tonight Dr. Praveen Arany from University of Buffalo. He has a wealth of knowledge on PBM. He's been head of the WALT, that's World Association of Laser Therapy. He's also been instrumental in quite a number of studies on light on different parts of the body, and has done this for over 25 years, and is just a wonderful person once you get to know him, and the knowledge that he has in this area is tremendous. So I welcome you, Praveen, to our show tonight. And
it's a pleasure being here again.
Yeah, and tonight we're going to be focusing on burns and wounds and why PBM can be very helpful. So can you tell us a little bit about PBM first? What is PBM, photobiomodulation?
So it's interesting. I think what is PBM is directly connected to wound healing as a focus, because the very first observation with low dose laser treatments was stimulation of wound healing. And this field has several names. One of my colleagues counted over 350 different names. And everything from cold laser treatment to red light therapy to low intensity light treatment to soft laser treatment. I think the field is generally in agreement now that we should call it photobiomodulation, because as the term suggests, we are trying to use photons to modulate biological responses for therapeutic clinical outcomes. So the field now calls it photobiomodulation, or PBM. And as I just mentioned in the beginning of my sentence here, the very first low-power laser treatment was shown to improve tissue healing, wound healing. And this was work done by Dr. Andrea Mester in the late 60s. And ever since then, this process of wound healing and stimulation of light has been a central focus for the field. Now, as you know, wounds can be due to different reasons, underlying pathologies. Some common reasons are diabetes, pressure ulcers, as we know, causes tissue breakdown. There can be vascular insufficiency, where you don't have enough arterial or venous blood flow to a part of your body. And of course, the most common of them all, unfortunately, has been burns that can cause significant morbidity because the wounds will not heal well. So that's the whole spectrum of different kinds of wounds. And interestingly enough, PBM has been used either as an adjuvant or as a main form of treatment in many of these ailments.
Mm-hmm. It's beautiful to see. I'll have shown some slides on how fast some wounds have been healed, but you've got a good slide deck there as well. But it's beautiful to see how a wound like this, my granddaughter had burned down her leg from boiling water being poured accidentally down on her leg, and the back of the leg at 3.5 years, and went to the hospital. And then we got progressive pictures of them immediately using PBM twice a day. Right after they came back from the hospital, there was no more pain right after the first PBM treatment, and continued to be no PBM. Is that something that's, from the standpoint of pain reduction? I mean, you think of a sunburn, you go out in the sun, and you don't want to be out in the sun because the sun, certain rays in the sun are really feel like your skin is on fire, but that's not happening with red and near infrared, does it? It doesn't work that way.
Yeah. And I'm sorry to hear about your granddaughter, but I think having you as a grandfather has some advantages. So luckily she has access to light treatment, photobiomodulation. So pain as a part of the inflammatory process, right? We know one of the cardinal signs of tissue healing is pain, right? That comes from the process of injury, but it also comes from the process of healing. When you think about the tissue that is missing or damaged, there are pain-causing substances that cause that perception of pain.
Oh,
And that has to be relieved before inflammation can be resolved. And that is the initial pain that patients have when they get an injury. Interestingly enough, when the tissue is also healing, there is this perception of pain or itching. Anyone who's had a wound or a bruise and it starts to heal, especially a burn wound, it gets very itchy, right? And at that point, we have realized that when you look at the tissues, the nerves that innervate that area are, for a lack of better term, sprouting or reaching branching morphologies that make it more sensitive to pain. So you get hyperalgesia or that itching sensation. So pain as a sign of inflammation and injury is important, and relieving that will kickstart that process of resolution of inflammation. It is also a big part of the regenerative process, and speeding that along by resolving pain will allow the healing process to be accelerated.
In her case, doing the daily treatment, day 7, the scabs were still evident. They figure 2nd-degree burns and maybe even a spot or two, a third. But day 7, there was scabs on it. Day 8, the scabs had actually all fallen off, and there was a full, complete layer of skin across the whole area. And so people have said that that's incredible speed to see a full healing of the surface area. Right. Now, obviously, more layers have to be built up, and but the other thing was, which you could comment to, is the lack of scarring that was showing. Do you want to comment? Because there was after a month, it was hard to see. There was still some discoloration, but then after 2 years, there's nothing to see. Right. Can you comment to that?
Right. So I guess let's start with the first part, which is reformation of the tissues, right? And we know that burns are specifically very challenging because a lot of dead tissue, especially in 3rd-degree burns, has to be removed by the body, right? Either shed off as scab, as you pointed out, or at the smaller fragments of the dead tissue, necrotic tissue, has to be phagocytosed by macrophages and inflammatory cells. So it's a lot of cleanup that is necessary for a burn wound, which makes it even more challenging than a regular wound. A regular wound, you might have like small pieces of debris around, or maybe a biofilm because of infection, but it is very small in its quantity and easier to get rid of by the body. However, in case of burn wounds, the damage is so much more substantial that it presents a unique challenge for the body to heal itself. Now, the persistence of a burn wound unfortunately causes a persistence of the inflammation because it's trying to repair this damage. And as a consequence of that, we often see burn healing associated fibrosis or contractures, which is very common, right? So unfortunately, the inflammation that is trying to clear up that damaged area is also contributing to the fibrotic process, which results in the scars. Now, if you intervene with light or other effective wound management techniques, you can prevent this persistence of inflammation. And again, our lab and many other labs have focused on when we should do PBM treatment to get optimal resolution.
Right, right. And this is, as you mentioned, for wounds, it carries right over to wounds or diabetic ulcers where it's a mess and the body has to clean it up, and where photobiomodulation can help improve the whole function.
Right. So diabetic wounds are very unique challenges. As you know, there is a very unique pathophysiology underlying diabetic wounds. Not only does it compromise circulation in that local area, but because of immune dysfunction, these wounds are more prone to infection. And to compound the problem, there is also breakdown of tissues because they are not being adequately perfused or are infected. The other problem with diabetic wounds, unfortunately, is the neuropathy, right? So you get loss of sensation, which causes them to have more damage. So the reason you get diabetic foot ulcers is partly because of loss of vascular supply and immune dysfunction. But a major part of that is that they are more prone to trauma because of the neuropathy.
Right.
And that complex underlying pathophysiology of a diabetic, let's say, foot ulcer can also be assisted. I don't think PBM is the only treatment in these scenarios. You must do good wound management, debridement, hydration, disinfection. But PBM has been shown unequivocally to add to this wound management armamentarium. It can actually be a very important supportive tool that can improve your clinical outcome.
Right. Just to back up to burns once again, the nice part about with PBM is if you speed up the healing process, you have less chance of infection coming in and other problems. Am I correct in saying I've read somewhere about faster cross-linking or things that are happening to the surface of the skin that helps speed up that time and helps reduce the possibility of infection.
So that is one of the principles. So when we think about wound management, we often refer to the acronym TIME, time, right? And a critical part of that is exactly as you pointed out, the ability to speed up the resolution that allows the healing to be completed. As long as you have a source of inflammation, the healing will not proceed, right? And that is where, when you think about bed sores or any of the other chronic wounds, you have the persistence of the inflammation that is preventing the healing from taking place. Just because you are good at wound management with any technique, not only PBM, it is not the active promotion of healing. You're allowing the body to heal itself, but you have to get rid of the source that is preventing the healing. And in case of burns, which I think we want to talk a little bit more about, we have found that PBM can specifically enhance the resolution.
Yeah, and so there's not only the improvement in blood flow through the area, but lymphatics. Can you speak about that a little bit?
That is, so one of the problems with PBM, as you well know, Tom, is that it can do multiple things. And that has also come back to hurt us in the field because it can do so many multiple things. And I think one of the big things I'll emphasize before we talk about lymphedema is that the field is moving towards a diagnosis and a prescription when we think about PBM. So what are you trying, and wound healing is an example, excellent example, because it has components of pain, it has definitely inflammation, and of course there has to be resolution so that the tissue healing can occur. And here's a good example. So a big part of resolution is the lymphatic clearance on that area. And I think you're specifically referring to breast cancer patients who unfortunately have their axillary lymph nodes or their local draining lymph nodes removed. That results in tissue edema, right? And it has been shown that using PBM in the area of the edematous tissue, as well as the draining local lymphatics, assists with the clearance and resolution of this condition. And again, there are several human clinical studies that are very, very convincing. There are also very elegant animal models where we induce inflammation in a local area, especially the paw of the rodent models. And we can actually show very, very cleanly that PBM and PBM alone can resolve that edematous paw and improve the clearance, local lymphatic clearance.
Thank you. So is there any other comments before you get into the slides that you think would be helpful?
I think we touched on the highlight of, I think what we all want to emphasize is PBM is a wonderful treatment, but you must understand what you're trying to treat. Just like we have a diagnosis and we prescribe a particular treatment, we need to be thinking of PBM that way. Just because PBM works in, we just talked about lymphatic drainage, we talked about burn wounds, we talked about diabetic wounds. There are different components of those diseases that will benefit from PBM, but we need to be moving towards a prescription, right? Are you trying to resolve the inflammation? Are you trying to relieve the pain? Or are you trying to improve resolution?
Right, right. Well, if you'd like to start with your slides, then you've got some excellent slides.
So I'd like to show a couple of slides. I don't want to take too much of your time, but I think we gave the examples of wounds and how we like to do some very specific. Can you see my slides?
Yes, we can.
Okay. So we like to do some very discrete molecular mechanistic experiments to prove that PBM is actually working very well, right? So as many of you probably have heard, there are multiple mechanisms of how PBM works. The most popular in the media has been the role or the effects on mitochondria and cytochrome C oxidase. But we know that that is one of three major mechanisms that are responsible for the PBM therapeutic benefits. The second mechanism actually works very specifically on pain receptors and transporters. And we know that we can inactivate pain conduction in a reversible and transient manner, just like local anesthesia. And this can result in pain relief in our patients. The third mechanism was described by my lab, where we focus on the effects on a molecule called TGF-beta1, which is known to promote wound healing. When you activate this growth factor, as shown in this figure here, you can see that when we do PBM treatments, the regular, or what we call the wild type latent TGF-beta molecule, can get activated. This is a Western blot for SMAD2. You can see that PBM is able to activate signaling. And when you make burn wounds in animals that have been treated with PBM, and these are full thickness, third degree burn wounds, you can see that PBM treatments is able to significantly improve the healing response. These are the images, and this is the quantitation on your right side.
Right. So your control is on the top row there, and your
the top panel
PBM
is the control.
Yeah, and day 7, you can see the dramatic difference in area of the wound.
So when we do experiments like this in the lab, we like to ask the question, how do we know that TGF-beta is responsible for this improved impact? And we can do that by simply making another transgenic construct, as shown in this image here. We have substituted the isoform. By doing that, we cannot activate the TGF-beta molecule, as shown in this panel here. You can see that in this panel, PBM is increasing the amount of TGF-beta activation. But in this particular animal model, we cannot see the activation. So as you would predict, if TGF-beta is responsible for this improvement, in this transgenic knock-in model, you can see that the wounds, this is the control wound, this is the PBM-treated wound, and you can see that the wound actually does not improve. In fact, it seems to be getting a little worse in some cases. So these kind of experiments in the lab give us confidence that we can implicate a specific therapeutic mechanism that is responsible for wound healing. We were talking about a prescription and a diagnosis. In this case, we know we want to target TGF-beta activation with light. And you can see that these are the results. So when we do other experiments, in this particular case, we were looking at macrophages, which are responsible for resolution. And you can see that the amount of macrophages can be selectively modulated with the use of PBM, as you can see in this image here. And the reason that we see an improved healing is because we are enabling the macrophages to gobble up the dead tissue and improve the resolution. So here is an example of what we do in the lab, where we provide small plastic beads, polystyrene beads, to macrophages. And when you do PBM treatments, you can see that the amount of eaten up polystyrene beads is significantly higher compared to the controls. So here's the same experiment done in animals, and then we do all these, microarrays and gene expression studies. Here's an example of how in vivo, that was an experiment we did in the lab with macrophages on a plastic dish. But even in the animal models, we can significantly modulate the inflammatory response. And again, I'm not going to go into the details. All of this work has been published if anyone is interested. And we have found that TGF-beta, as you can see in this image here, is central to many of these gene expression changes. And thereby we can actually selectively target TGF-beta in our wound healing experiments to improve the resolution and the healing responses.
So this is published on which group have you?
This is in Scientific Reports in 2015. So for those of you who are interested, either reach out to Tom or you can email me. I'm happy to provide the data.
Excellent.
So I didn't know how much more detail to go into, but basically that demonstrates that we understand why the PBM is working in wound healing. And we have further understood that it's the resolution phase, specifically mediated by macrophages, that is primarily responsible for aiding that wound to get better.
Excellent, excellent. So do you, by chance, do you have any other, let's say, human slides by chance or not?
Not in this slide deck. I'm
oh,
sorry.
okay, all right, fair enough. But you do
there
have.
are, if you look in the literature, I'm sure you'll see that there is significant evidence. We actually have a paper that we published on burn wounds in human patients. It was a review that we published. It's an advanced wound care. I can make that available to you, Tom.
Yes, if people go to our website, SunPowerLED here and .com, and go to the resources page under PBM findings, they'll see the database that has now close to 70, I think it's 7,700 research papers. And if you type in there Control F to find particular studies, if you put in Dr. Praveen Arany, or you just shorten it to just Arany, you'll find, I think, what is it, a dozen papers now you've put out there? Or, is it a dozen? Or I'm sorry, I can't remember.
So one of the primary goals of my lab is to understand wound healing. And we have several papers in different wound contexts: wounding of the teeth, wounding of the mucosa, and skin in different kinds of wounds.
Right. And I guess one other area too that is wounds is the whole area of the mouth with oral mucositis. Can you take a moment and just mention about that? How it helps the mouth to heal?
Right. So that is where we have actually the strongest evidence, because the evidence there has led to a recommendation of a clinical practice guidelines that will help all cancer patients. So when we are treating a patient with cancer with chemo or radiation or stem cell transplants, unfortunately, they're also damaging the normal tissues that are being exposed to these agents. And one of the common clinical presentations of these patients is mucositis in the mouth, as Tom, you pointed out. If you do photobiomodulation treatments 30 minutes to 2 hours before the patient gets chemo or radiation, it has been shown in 35 placebo-controlled randomized human clinical studies that there is significant evidence of preventing or reducing the severity of oral mucositis. Yeah, and this is now at the level of clinical practice guidelines. So we basically recommend that every patient actually get this treatment to get the maximal benefits.
And that's right now the standard of care in California. They're suggesting that. Is that?
I don't know about California, but
okay.
I would say that the three organizations that did the initial assessment was the Multinational Association of Supportive Care in Cancer, MASC, the International Society of Oral Oncology, and the World Association of Photobiomodulation Treatment, WALT.
Wow. You have brought together a lot of information, and you only got a chance to give us that little tiny amount of information just on burns and wounds, but so many different areas of the body can be helped with this light technology. Having the right amount of light to reach the depth that you're trying to, the right wavelength, the right power density, all those things are important factors. And I want to thank you very much for coming on today and being able to do this recording with me. And we would love to have you come back again on another, where we can talk about one of those other areas of and we can keep this series going for the next 10 years, I think. Anyways, thank you very much, Praveen, for coming on, and all the best to your studies that you're doing at the University of Buffalo, and working with many world leaders in this technology. Thank you.
Thank you for having me, Tom. Good
All
night.
the best. Bye for now. Well, I hope you enjoyed that. Please ask your questions to the left-hand side. It's on my left-hand side, but ask your questions. We're going to try and get through them. There's a lot of questions coming up. We may end up going overtime here a little bit, but I want to first say that just tell you a little bit about our lights. So we have for those that are here at first time, so we have different versions of lights. We have the Palm Professional, we have a Palm Classic. Really, the Palm Professional is a really good starting place, where you have both near red and near infrared. That's 660 nanometer and 810 nanometer. It has a significant amount of optical power per square centimeter over this very large area, which is quite important because that helps with the depth that you will treat. That's our Professional. There's different prices. We have the 975 for the Professional. We have the Ultimate, which is this next model. It's same size, but the same surface area, but now it has about 25% more optical power. Helps to get just a little bit deeper and do things a little faster. So in this case, I'll just do a little demonstration here. Here's the 660 nanometer, and you can see the light going right through my hand, in the part of the palm of my hand. It has the 810 nanometer too, which doesn't look very impressive, but it's only because our eyes can't see it, neither does the camera see it very well. But it actually would be streaming through my hand. It's got that kind of optical power, and because of the wavelength of 810 nanometer, it even penetrates deeper. That's our Ultimate. And then we have what we call the Super Palm. That's the one we gave away earlier, and we'll be doing that again at the end of the month. This one here has the same 660 nanometer wavelength that you see here, the bright red, and also 1050 nanometer. Now 1050 nanometer, I can look at this and there's nothing I can see, but it actually can be picked up as purplish dots here on the screen. The little red indicator on this side is just there to help people to understand that it's working. It's an indicator that everything's working fine. So that's our newest device on the block, which is the Super Palm 1050. Then I have the helmet that we've developed, and this helmet has 10 of the Palm lights inside, basically 10 of the Palm lights. And if I turn it on, the one wavelength is the red, the bright red, and the other wavelength is the 810 nanometer. It is possible on a special order to get the 1050 nanometer, but those are the two wavelengths out of this device, and it just lowers down on top of your head or on top of the patient's head and is able to treat. We got some trials going on with this for opiate addiction and depression. There's some other trials going on as well. So that's with that device. And then we also have the what I call the mini canopy. This device here has basically the equivalent optical power of 15 times the optical power, but it has 15 times the area. So it's very similar to the Palm Ultimate, but it's much greater area. So it has the same 2 wavelengths. It has the 660 nanometer, and it also has the 810. You can kind of see the 810 nanometer there. It's not very bright, but that's just because it's not very visible. So that gives you an idea of the 2. So this just goes over, and it has a nice stand that lowers it to the height that you want above wherever you're trying to place it. So those are different models, and gives you a little bit. Now I'll try and answer some of the questions that have come up here. All right. So we have an anonymous saying, "Thank you for your knowledge and time. PBM has been life-changing. I recommend PBM to lots of people, but they are concerned with skin cancer. Can you provide resources to allay their fears?" So it turns out that more recent studies are showing that light does not do, PBM does not do anything to promote cancer cell proliferation. It does help with normal cells, but with cancer cells, it kind of creates a negative atmosphere for the cancer to grow, because it's creating a lot of oxygen-rich blood that's flowing, lots of blood, but it basically is not a good environment for the cancer to grow. And that's what there's some research that shows. There was a time where it was thought that maybe you shouldn't be using it over cancer, but as Dr. Praveen Arany said about the oral mucositis, now people with even chemotherapy or have even cancer inside their mouth, the light therapy is able to really help improve their situation and help heal the areas. Congratulations from Craig for Wesley. Yes, we congratulate you, Wesley, for your winning of the light. Okay. I have read that PBM can be harmful for lupus patients. Is this accurate? I do not believe that that's the case with lupus, but one thing with lupus is that you can help treat some of the symptoms of lupus, and there is other research that Dr. Praveen has pulled out that will show how it can help with some of the things that happen because of lupus. How long should we do the 660 and the 1050 nanometer wavelengths, and how much is too much? Basically, with our devices, it's very different from lasers in that with lasers, you have to be very critical on how much time you have, because it's such a very, very dense amount of light. Let's say if it's because a laser has a lot more, a very high amount of energy in a small area. So it's very easy then to be too much power. Whereas because I have the energy, a lot of it spread over a larger area, that allows you to not have any high concentration points of light. So it's very forgiving as to being able to treat for a long time. I have had some people fall asleep with the light on their neck or on an injury, and I'm not suggesting that at all, but it has not hampered the reduction of their, let's say if they've had muscle spasms or something like that, or other healing, they've still seen that they've had improvement. So not that I suggest it, but generally what you're talking about is you only need a couple minutes if you're treating something like your hands, very thin profile. If you're trying to go through your cheek, you're looking at 5 minutes, 10 minutes if you're trying to reach into the inner gum line. I'm just giving you general parameters. If you're trying to treat your shoulder, you're going to need anywhere from 10 to 15 minutes possible. Definitely, if you're looking at a hip, 10 to 15 minutes to have enough energy to reach the depth. That's gives you some idea, and you can treat more often than once a day. And I've seen some people with injuries to their knees or other things, and they've seen very quick change of in their situation using the light even up to 3 times a day. I guess, we eat 3 times a day. These cells are very hungry. They need energy, and they will burn it up as they're using it. So it's not harmful to help them. You're basically giving energy to the mitochondria, and the cells know what to do with the energy. It's like giving all these cells full gas tanks and keeping them topped up if you do it more often. Craig is asking, what about this light is very bright? Yes, it is. But the amount, you say, how safe is it around the eyes? Well, all of us have been out on a beach during the summertime. We've closed our eyelids and have been in front of the sun. Now, I'm not talking about the UV portion of the sun, but you get a suntan or sunburn if you're not ready for taking the UVB or the UVA as well you don't harm your eyes if you have your eyelids closed. We have a similar amount of power to the sun per square centimeter. The sun actually has 100 milliwatts per square centimeter in the whole band of some blue to the red spectrum, but there is some UV there, but nothing gets past the eyelids. Nothing. No UV or blue gets through the eyelids. It's the red that's getting through. And there's a company out there that makes a device to actually heal the eyes with light. Not for the laser treatment. There's a different kind that for wet macular degeneration. It's already approved for in Europe, but basically what I'm saying is that the same light that's coming from the sun, same light energy per square centimeter, is coming out of our device. So as long as you're using that light, and if you're using it up to treat sinuses or those kinds of things, keep your eyes closed. Don't stare at the light for a half an hour. That's not the way, it's very, very bright. So you use it, close your eyelids if you want to, or you can use special, either darker, really dark sunglasses, or there are special glasses that'll block the light. Those are specifically used for laser. When it comes to laser, you have to wear glasses. There's no ifs, ands, or buts, because that laser can remain as a spot on the back of the retina and burn the back of the retina because it's very high concentration. Whereas LEDs have a diffusion beam coming from them. It's not coherent light, it's a diffused light, which by the time you're any distance away, it's very even, very uniform, and so there's no hot spots. One thing I just remembered to show, and I don't have a single paper, so I'll use just the paper out of the book here. If you take a light like this and you put it on there, you can actually see that the light is very even over that whole area. that's coming out of this device. So there's no hot spots. As I pull it back, you can see it's diffusing to a larger area. So that's why it's very safe around the eyes. Janet asks, that's from Andy, by the way. Sorry, that was from Craig. Andy, how many minutes was the PBM device held against the skin to assist with the healing of various burns and wounds? As a matter of fact, my granddaughter there was using the mini canopy, the large one that you see up here. And so she used it from about 3 inches away, and they would do about a 10-15 minute treatment. Because it was further away, they didn't have to bring it right up. The power level, power density is lower, so it's a very even area, covers even more area, which is fantastic. So when you're trying to treat a very large area, just pull it up back a little bit, but that does decrease the amount of energy. So anyways, we with the light, if you're just trying to treat the skin and you have a smaller area to treat, 1-2 minutes of the 660 will be plenty. Another question from Anonymous, which wavelength do you recommend for burns, healing, extraction, sockets, gum grafting, and bone grafting? I can answer those questions better when I got a little more time, but basically the 660 nanometer has got the longest track record. It's possible to get one of our devices if it sounds like you're into dentistry. So we do have a piece that can be added to our device, which is an oral probe. So it can be put directly if you're using 660. If you're trying to treat from the external area through the cheek, really the 810 nanometer has the potential to penetrate the cheek easier and get more energy on the gum line. So it would be possible either to treat with one of these devices with the optical probe, or you could use the device itself. And what's really cool is the good questions that you're asking with healing, extraction, sockets. There's a lot of information that shows how that works. Also, I've got a number of dentists that do talk about the light therapy. There's also different ones that I have on my videos page. You can look back at various other webinars that I've done. We'll be wrapping up very shortly here. We will still, if you have to drop off, no problem. We'll still count you in as in the draw. Could do that to you because I am going a little over time here. Shepherd. Janet mentions Shepherd Wellness recommends drinking lots of water after PBM treatments. Are there any vitamins or supplements in food sources that increases the PBM effectiveness? I can't say on the supplement side, but I will say that drinking lots of water. Many people who experience the mini canopy that's up here or the larger canopy, they end off, if they don't drink water before they start, because it helps with the lymphatic drainage and other things, you end up with being very thirsty, and your body works better with proper hydration. So please consider that when using PBM in treatments, to be well hydrated. Very good, thank you, Janet. Okay, it's just my end, or are other experiencing the sound dropping out tonight? Not that I'm aware of. I'm sorry if it has been. We lost this section on the video there. We're sorry about that, just the way we clicked on some things. So okay, but we did play everything that we had. So once again, sorry about the repeat, but we just want to make sure nobody missed anything of that really good interview that Dr. Praveen Arany did for us. Does the 1050 wavelength heat up the tissue? and so yes, there will be some warmth coming out of this, or a little bit of heating. If it's uncomfortable, as far as being a little warmer, it depends on the blood circulation. If your blood circulation is very poor in the area, you'll end up noticing that until the blood circulation improves, which can happen even during a treatment, that the very first part will be warmer, or even maybe hotter to the at least the sensation. And if I'm, if you get into a case where it feels a little bit too hot, you can either pull back the light unit back a little bit from the surface. It just treats a larger area, drops your intensity a little bit, and would also drop the amount of energy that's there. So just pull it back just a little bit. That's another way of getting around that. But the 1050 has the potential, but it really, the 1050 ends up being able to treat deeper, a little deeper, because of the wavelength of 1050 as opposed to 810. And it does cost us quite a bit more for the LEDs for the 1050, so that's why we have the premium price of $1,900 on the unit. Which, by the way, if I would like to encourage some sales tonight. If people are looking at buying one of these things because it's Christmas time, or for one of their family members, or if it's anybody in for themselves, if you go on to if you go on to my website and use the promo code of promo 100 tonight till midnight, the promo 100 tonight till midnight Pacific time, there'll be $100 off. Okay, a couple more quick questions and then I think we're good. Can symptoms worsen before getting better? Sometimes you may feel that, and that's possible. Jesse is asking, how are you using it for Alzheimer's? We're just starting to, I know some others have looked at helping with Alzheimer's. I haven't got there yet, but we actually have one of the very, very knowledgeable people on tonight, Dr. Margaret Naser, and she has done all sorts of research in the area. By the way, there's she mentions to me, I just wanted to mention that the LED treatments have been done for dry macular degeneration, not wet. I'm sorry, I got that mistaken. My apologies. But thank you, Margaret, for pointing that out to us. Okay. Okay, I had asked Jennifer, but this is by Beth. She asked another person about about blood clots, and because this is doing it as a cell-by-cell basis, it's possible. I had somebody that had used the light. In their case, they had a blood clot in their leg, and they were very happy that it helped reduce the pain quite a bit. I can't. It's something that you should check with your doctor or somebody with knowledge in that area. But it definitely helps the blood flow on the microvascular side. So anywhere and that could help relieve pressure probably in that area. Which wavelength works best for deep muscle injuries? Either the 810 or the 1050 is very good for deeper reach, deeper muscle injuries, deeper back injuries, reaching to the bone for helping to heal the bone, that kind of thing. Okay. All right. I think www spelled them wrong in the chat. Okay. Yeah, the website is www.sunpowerled.com. I encourage you to send your questions to, oh, there we go. It's already corrected. SunPowerLED.com. And I encourage you to send questions to info@SunPowerLED. I want to thank everybody for coming on tonight. And I just want to remind you that there's the $100 discount till tonight, promo 100 till midnight Pacific time. You can't, this is a device, one of these devices, whether it's the Palm Professional, Ultimate, or the Super Palm, is devices that will keep giving as far as something that's not something that will be stashed in the corner. It will be something that you will continue to use for your health of yourself, your family members, and even friends outside of that will be very thankful. And please spread the word about our webinars that we have. And we would love to have even more of you join us. And it's been pretty neat that we've seen different countries join in from different parts of the world. So thank you everyone for coming on tonight. I hope for all of you, you have a really blessed Christmas, fantastic Christmas. And we'll look forward to seeing you next Tuesday. Same time, same place. All the best. Bye for now.